So good morning, good afternoon, good evening, wherever you are. We're about to start the seminar, but please, we want to give 1 minute for people to join. So please, we'll start in 1 minute's time. Okay, so good morning again, good afternoon, and good evening, wherever you are joining us from. Let me welcome you very specially to the September 2023 Union of Africa Population Scientists Seminar on Family Planning, Sexual and Reproductive Health. Today, we are privileged to have Dr. Jason Bremner, who is the Senior Director of Data and Measurement at Family Planning 2030. He will be talking to us on family planning measurements and advancement. My name is Akoni Akinyemi. I'm the chair of the panel, and I also have Dr. Estelle Sitsi from APHRC as the co-chair of this panel. We gave our special appreciation to Bill and Melinda Gates Foundation, the Gates Foundation at Johns Hopkins University, Baltimore, and Maryland for providing support to this panel. So let me read a brief about Dr. Jason Bremner, so then you can take it off from there. So Dr. Jason Bremner, PhD and PH, is Family Planning 2030 Data and Measurement Senior Director. He joined the FP 2020 Secretariat with over 15 years of professional experience providing technical leadership on research translation, policy analysis, data for decision-making, and individual and institutional capacity building. Jason was the Associate Vice President for International Programs, Programs Director for Population Health and Environment, and the Deputy Director for the USAID-funded PACE project, Population Reference Bureau, PRP. He received his PhD from the University of North Carolina, and that's an MPH in Global Health from Emory University. He also has a wealth of direct country experience in many of the FP 2020 focus countries, particularly in Africa, including Ethiopia, Kenya, Rwanda, Tanzania, Uganda, and also outside Africa in Nepal and the Philippines. So as Data and Performance Management Director, Jesse is leading efforts to embed the use of data and performance management approaches through a performance monitoring and analysis of the FP 2020 movement to provide trusted and transparent information regarding progress towards reaching the FP 2020 goals and strengthening accountability for implementation of financial policy and programming commitments made by the country governments, donors, and the UN, and other stakeholders. So it's my honor today to give the floor to Jason. Jason, please, you have the honor. Jason will talk to us then. Please, if you have questions, you can just put in the question from Jason, please. You have the floor.
Thank you, Akani. A pleasure to join you, and thank you for the invitation from this UAPS panel. I've been watching from afar as this UAPS panel on FP and SRHR has been active over the past several months, and I've been able to join some of the webinars. Akani and I know each other from the FP 2030 Performance Monitoring and Events Working Group, so it's also my honor to join you and to have Akani as a member of that group. I'll give a bit of a history of the FP 2020 measurement agenda and how that has transitioned into the work that we're doing now as FP 2030. And I'll try to bring up some of the challenges ahead and how FP 2030 is working with partners on advancing family planning measurement, and try to spark a discussion here about how members of UAPS, IUSSP, ICFP can participate in advancing family planning measurement. Akani mentioned the question and answer panel. The chat is also live, so please feel free to introduce yourselves to one another in the chat. I always encourage a lively discussion in the chat. I have some colleagues who are on who will help me with posting some links to resources in the chat as well. And I do know that interpretation is available. So for those who speak French, please do use the interpretation at the bottom of the navigation bar. And I hope to have a relatively short presentation so we can have lots of back and forth and lots of questions. Great to see friends and colleagues, old and new, online. So I'll go ahead and get started. Next slide, please. So I want to, before I talk about the future advances and the future work ahead of us, I want to look back and give some context of where I think we have come from, where we have made improvements, and acknowledge where we haven't. So let me first talk a bit about some of the FP 2020 measurement successes. Next slide, please. I like to think back to my years at Population Reference Bureau before I joined FP 2020, working with decision makers on looking at data, communicating data, working with advocates and researchers on communicating their findings. And I have to say that we and I felt somewhat limited at the time to the data that was periodically available with national health surveys, such as the Demographic Health Survey, the Multiple Indicator Cluster Survey. I remember working in Kenya ahead of the Demographic Health Survey, in which we hadn't had data since 2008, and we're waiting a long time for the next survey. And there was this story of stall in Kenya, family planning stall, that many probably here know well and better than I do. And then we waited. We said, we made changes, we worked on priority setting, and the government did prioritize family planning. But we didn't have a lot of data to determine whether things had changed. And it was years until we got that next family planning survey before we could really confirm whether things had indeed changed. And I think that story, that experience of mine was repeated over many countries and has been repeated for a long time in the family planning community. And I'll say, while we had family planning service statistics from HMIS systems, their quality was often called into question. Their coverage was often incomplete, so we knew that not all service delivery points were reporting. And because of those quality and coverage issues, the service statistics were not used consistently. And then finally, there were a lot of indicators in which different partners, different surveys were using different definitions, slight adaptations of indicators, and it was difficult to look across countries or even over time at particular indicators and compare countries or compare a country over time. So I like to think of this as, this is much of our history. I'm not saying that family planning hasn't benefited from a great amount of investment in those demographic health surveys, in those systems, but I think we had a period where we got to a point and we weren't seeing much advancement. So then that is the context, I think, pre FP 2020 and pre-investments, some additional investments in data. Next slide, please. With the launch of the FP 2020 goal and the FP 2020 partnership, there was an explicit desire to monitor progress towards that FP 2020 goal of 120 million additional users of modern contraception across 69 focus countries at that time, the poorest countries in the world. And a set of core indicators was established to provide an annual global readout of key progress that would be comparable, it would be applicable and available across countries and comparable. So there was a set of core indicators established. This was established by an expert measurement group that became the Performance Monitoring and Evidence Working Group that still exists today, and I'll talk a bit more about them later. This kind of reporting could be done at, you could think of doing this at a global level. The UN POP division often produces estimates across countries, but that doesn't guarantee that country partners and countries own that data and feel like they understand where the data came from. So we want to establish a different type of process from that of a sort of global reporting. And so we established a country-led process for reviewing data, assessing progress, and reporting that to FP 2020. And that resulted in an annual FP 2020 progress report summarizing key global and regional data and measurement findings. Prior to this, we did have reports such as the UNFPA State of the World Population Report, but the State of the World Population Report is not a deep dive into family planning. It is a look at a broader set of indicators and not specifically diving into very important aspects of family planning programs that help countries to assess progress, assess method availability, method mix, and many others. And we'll look at those country or core indicators in a moment. In addition to all this work on family planning data, there was a desire to improve the tracking of family planning financing. Next slide. The FP 2020 core indicators included 18 indicators with some subparts. Many of you are probably familiar that we were tracking at that time additional users of modern contraception across the 69 countries and aggregating that to assess progress towards that additional users goal. But at a country level, countries were really assessing a different set of indicators. These other indicators that were really part of their national program goals, of the FP 2020 commitments that they established, and those included modern contraceptive prevalence goals. It included desires to expand method mix and method availability, indicators on stockouts. It included indicators on the CYPs, or couple years of protection, that encouraged the use and examination of service statistics. It included proxies for quality of information and counseling that clients were receiving, and additional indicators looking at impact of contraceptive use on averting unintended pregnancies, maternal deaths, unsafe abortions. And finally, understanding continuation and discontinuation, as well as switching of contraceptive use. So these were the 18 core indicators that we monitored during the 2012 to 2020 era, and that we produced an annual report on each year through that country-led and bottom-up process. Next slide, please. This bottom-up process was established by the Track 20 project at Avenir Health, a key partner in the FP 2020 data and measurement agenda, and a series of Track 20 M&E officers at a country level who were aggregating data, analyzing data, using statistical models to take all past surveys and service statistics into account to produce annual estimates of key indicators. And then bringing that together in around the May to July period each year for data consensus meetings, in which partners, stakeholders in family planning programs in countries would review progress, discuss whether there'd been progress, whether there were challenges, shift priorities, talk about advocacy, and policy changes that might be needed. and ultimately then report that data to FP to Track 20 and FP 2020 so that we could produce that global report. There's always been an acknowledgement that the core indicators are not sufficient on their own to assess progress. They are an encouragement. They are essentially the building blocks of producing this annual report and the process for discussing data. At a country level, we know countries should be diving deeper into their service statistics. They should be looking at particular program priorities around social behavior change programs, around demand creation, around adolescents and youth, around postpartum and post-abortion family planning. So these are not sufficient. The core indicators are not. And the core indicators weren't without their problems and their challenges. And so recognizing that the annual measurement report is not complete, I think that sparks a question of if it isn't complete, and if there are still challenges, then how do we overcome those? Next slide, please. Well, one thing that we have always done is talk about those measurement challenges and measurement advancements in each family planning 2030 progress report and measurement report. Here you see screen grabs or the cover images of each of the FP 2020 and now the FP 2030 reports. I have worked on these, gosh, I can actually start counting them now. If I 1, 2, 3, 4, 5, 6, 7, I've worked on 7 of these, and my team is working with Track 20 and the Track 20 M&E officers on the 2023 report, which we will release later this year or early next year. And in each of these, we do an aggregation, a sort of general overview look at family planning progress. We also bring up those measurement challenges. Next slide. This annual reporting process has led to opportunities to examine data in new and different ways. One of the things that we have really talked about quite a bit is the growth in contraceptive users. And that's not just talking about the number of additional users. It's talking about the base of contraceptive users that programs need to serve each year, just even to stay steady. Even if contraceptive prevalence stalls, in the case of Kenya that I talked about in the 2008 period, or those mid-2000s, it stalled in terms of prevalence, but a reminder that the population of women of reproductive age was still growing. And so the number of contraceptive users that programs needed to serve was not staying steady. It was actually growing during that time. And this is the case for all of the FP 2020 countries and FP 2030 countries now. So we wanted to bring light to the fact that even in a country like Nigeria, where growth has been slow in terms of prevalence change, the total number of contraceptive users that program is serving each year is growing, is expanding. The resources needed, the contraceptive supplies needed, the personnel needed, all continue to grow. And so this is something that we feel like we brought to the conversation and continue to bring to the conversation. And it's just an evidence of how we use the measurement report to bring light to important critical issues. Next slide, please. I hope many of you are familiar with the S-curve pattern of contraceptive prevalence growth that became an important conceptual discussion about what countries could expect in terms of growth in contraceptive prevalence over time, with different expectations as countries grow into a high prevalence, into this high prevalence range, that they shouldn't expect growth rates to continue to accelerate, that things generally slow down when you get to high prevalence, and that when you get to higher levels of prevalence, your priorities need to shift. You may need to start focusing on marginalized populations, on a different method mix, on sustainable financing. So those kind of priorities may be very different from the priorities of a country that has had traditionally low prevalence, and where there's an opportunity to start to work on social norms and on supplies as well. And so we really feel like these are the types of concepts that we have continually explored, and that with Track 20 have, seen countries use this to think about priorities. So we use the measurement report to bring focus to this, but it's also being discussed at a country level, as I mentioned, in terms of data use and priority setting. Next slide, please. The FP 2020 measurement report, as I discussed earlier, focused on improved tracking of financial data, and together with many finance partners, we have focused on donor disbursements for family planning, domestic expenditures for family planning, and how those relate to one another. And here you see the work of the Kaiser Family Foundation, or KFF, on donor disbursements for family planning. And the level of the bar, or the height of the bar, shows the total donor disbursements, bilateral disbursements for family planning from 2012 to 2021, which was the last year's report, the period we had financing data for. And you can see these fluctuations. We also break this down by government donor, and you can see the color bars relating to different donors. This is available in our measurement report. You can toggle, it is interactive, you can toggle the different donors and look at the amounts. I'm not going to get into the fluctuations right now. If you feel like asking questions about that, please do. But again, this focus on this brings to light the fact that even over this period of 2012 to 2021, we've really not seen large increases in donor financing for family planning, while at the same time we have been articulating in that previous graphic on total users that countries are serving approximately 90 million more women each year with modern contraceptive methods. So how is that happening? Where is that financing coming from? Are donors keeping up? Are countries keeping up? That's the kind of conversation that this sparks, and that we hope to continue to spark through the annual reporting of progress. Next slide, please. FP 2020 also, as I mentioned, acknowledged that a lot more work needed to be done on measurement. I mentioned some of the successes, but the Performance Monitoring and Evidence Working Group established a forward-looking measurement agenda for family planning, met regularly, biannually, to continue to advance measurement, focused on measurement alignment. I mentioned that there were different partners in different countries measuring data in different ways, which made comparison challenging. And I mentioned also that the group highlighted continued measurement challenges. Next slide, please. This collection of images to the right illustrates some of the products of that work, of convening the Performance Monitoring and Evidence Working Group, discussing challenges, writing commentaries, working on publications to bring light to measurement challenges and ways forward, working on indicator alignment so that partners might, or we would make recommendations on the best way to measure something, and then look to surveys to change to adapt to those recommendations. So that's included indicator improvement, new DHS questions, and these have been implemented in different ways, sometimes commentary, sometimes articles, sometimes specific recommendations into the DHS questionnaire improvement portal, and also new ways of reporting and communicating data in our own report and in our dashboards and other resources. Next slide, please. I'll ask my colleague Yassine Bai, who is online with us and in the chat, to post some resources. We, at the end of FP 2020, felt like we needed to communicate some of the measurement learning. We did a series of measurement learning series briefs, as well as webinars on many of these to support that messaging. Many of you may have participated in some of those webinars, and I appreciate that and thank you. For new audience, I always feel like there's a need to remind people or bring people back to some of the things that we've previously done. So I encourage you to explore these. These really set the stage for how we moved forward with FP 2030, the changes and transitions that were underway and are underway, and the continued work that we need to do. And with that, I'll start to transition to, okay, now with FP 2030, how are we continuing this work to advance measurement and advance data use? Next slide, please. Next again. So first, before thinking that we needed to completely overhaul everything with the transition to the FP 2030 partnership, we really did ask the community through a series of surveys, webinars, focus groups, what has worked well, what should we continue with, and what things need to change. The PME working group also, one by one, went through the core indicator framework and assessed each indicator and said, is this still relevant? Do changes need to be made? Should we delete some indicators? Should we add some indicators? And so the starting point was the lessons and what we heard from the community. And people felt like key lessons and key things that we did correct were a starting point. So we heard from the community that the focus on all women was critical for a rights-based family planning approach. FP 2020 always reported and asked countries to report on contraceptive use among all women. We recognized that countries, however, didn't always have all women modern contraceptive prevalence goals. Sometimes they had all women, sometimes they had married women goals. So we felt like while reporting on all women was still critical, we needed to break down the component parts. We now report on modern contraceptive prevalence on all women, married women, and unmarried women, and you can get those modeled estimates from 2012 to the year of the last report, which was last year's report, 2022. We moved away from reporting on additional users, which wouldn't give you necessarily the baseline of total users. We always communicated about the baseline of total users, but in shifting away from the FP 2020 goal of additional users, we just explicitly moved to the total users as our measure of quantum, or our measure of the amount of services that are being provided to clients. And so that is now available. And we also focused, while we were focused on and remain focused on expanding modern method availability and choice, we recognize that there are important dynamics happening in countries around traditional method use. And we felt like we needed to understand, not just understand, but also bring visibility to that traditional method use. And so you will now find reporting on traditional method use in countries where it's greater than 5% of the prevalence. So now for countries where traditional method use is common, you can see that across all of the reporting countries. Next slide, please. I mentioned that important updates had been made to particular indicators, and we continue to make updates in the way that we report on indicators and on the visibility or availability of additional indicators. So that remains a test, just giving people more data, more breakdowns, and more aggregation or disaggregation of some of the indicators, such as the source of method. So you can now find the source of method, which is a public versus private breakdown, and you can look at that by method in every country for which we have available data. We also wanted to bring light to the fact that all of the estimates that we are working with have uncertainty intervals. They have confidence intervals or plus minus around them. And so bringing literacy to the fact that a point estimate is a range, actually. A point estimate is within a range is important for understanding in countries, why if you have two surveys, they may not be, one may be slightly lower than another. And you say, well, does this reflect a lack of progress? Well, not necessarily if they are within the confidence intervals. In understanding that is, I think, critical to data literacy and to data use. And critical also to the FP 2030 measurement agenda has been the increased availability of adolescent youth sexual and reproductive health data. And we have a whole set of supplemental adolescent youth indicators that are beyond just modern contraceptive use. They include age at first sex, age at marriage, and age at first birth, along with the adolescent birth rate and contraceptive use. This is really important to understanding key life events, and those are all available on the FP 2030 website and in some of our data dashboards. Next slide, please. I'm not going to go through this. This is a set of, this is the current measurement framework or the current set of country indicators. So we now report on 20 to 25. There are a lot of sort of breakdowns of these, so I don't actually provide a single number of indicators. Many of them are the same with some adjustments, and there are some new ones, as I mentioned, and we're continually examining these and saying, are these providing the information that countries need and donors need and the global community needs to understand progress? Next slide, please. That bottom-up approach has not changed for countries that make commitments to FP 2030. There is the opportunity of technical assistance from the Track 20 project. The scope of countries, however, has changed. In the FP 2020 era, I mentioned that there was a focus on 69 poorest countries, and that was based on GNI per capita in 2010. And those 69 countries were set. Even if GNI was per capita was changing, and we knew that income levels were changing, that was the basis for the partnership, and that was not reopened. There were a few countries, however, who did request to make commitments, and that were outside the 69, and that sparked the idea that the 69 countries is limiting, and in the FP 2030 transition, we did away with that barrier, and really at this point, any country can make a commitment to FP 2030, and we encourage commitments from. We're trying to encourage commitments from Latin America, which are largely in the upper middle income range. We are looking now to Pacific Islands. We're looking to Central Asia, North Africa, countries that fall outside of those original 69. That, in terms of reporting, brought up some tricky questions. Do we do a family planning report for the entire world? Well, then we get into data availability issues and data alignment issues that we have not resolved yet. So as a starting point, the PME working group, together with FP 2030 leadership, decided we would start with a family planning report on the 82 low income and lower middle income countries. That doesn't mean that countries outside of that range can't make commitments, and countries have. We now have commitments from Namibia, from Botswana, and we are now including those countries in the measurement report. So we will have those countries included in this year's measurement report. At the same time, the World Bank is each year changing their categories of income. So how do we handle that? Well, we are now incorporating any country that through that transition process falls into the low and low middle income countries. So this year, Jordan unfortunately slipped downward into the lower middle income category. So we are now including Jordan. So we are adapting this each year as things change. We will never drop a country out of measurement. So if a country does move up a category, we will continue to report on family planning indicators in that country. But this is something, these are the measurement challenges that we face. The next tier, why not just do upper middle income countries? We know that brings in almost double the number of countries, or another 60 to 80 countries that would be added. And we would be doing a measurement report for 150 odd countries each year. And so we have chosen this and are welcome to feedback and other suggestions of how to do this. Next slide, please. The FP 2030 measurement report process remains the same. This idea that that the conversations should be happening in country, and that our goal of the measurement report is actually data use at a country level. The measurement report is not itself sufficient, and countries need to be reviewing their data and deeper data than just the country indicators. We now have FP 2030, I hope you know by now has regional hubs, and that is a new transition, a new architecture that we're working with as well. We are providing space in each measurement report for regions to determine thematic priorities they want to analyze and focus on that year. And so we want to broaden the tent for participating in that theme selection, which we have largely done through the FP 2030 and Track 20 teams each year. And this also provides us with an opportunity to continue to move forward with a conversation beyond just the acceleration of growth that was largely a conversation of FP 2020. And we know regions like the Latin America and Caribbean region will have different conversations around adolescent pregnancy, around method availability, where the method mix looks very different. And so it creates that opportunity, and we're actively working with our regional hubs right now to shape that. Next slide, please. We also are trying to reimagine the report itself and the resources available to the global community and to countries. I've mentioned the regionally led identification of themes. We're going to be working on new data visualization center with data dashboards and resources that improve on the past, increase access and availability, and just, gosh, my own ability to find the great resources that are available on the FP 2030 and Track 20 websites and other partners' websites. So we are trying to improve this user experience, and I look forward to unveiling new resources in 2024 and creating a new digital space for connecting a lot of the dots for partners on family planning data, financing, commodities, and markets. So our hope is to create I won't say it's a one-stop shop. I mean, I know we use that term too loosely, but we want to create a place where we can connect through to other partners' reports, knowing that the FP 2030 report depends heavily on other resources and other partners, and we want to make sure that everybody understands that architecture and the data ecosystem for family planning. Next slide, please. So in terms of family planning measurement advancement, I mentioned these examples on the right previously, and I'll say my goal, why am I here today? I mean, it is really to urge you all to participate in this process. I think we recognize and we have faced criticism, I would say, as a family planning measurement community for moving slowly, that our progress on measurement and has been slow. It's often organic, it's just kind of what people feel like working on or have funding to work on at a particular point in time. Sometimes in our case, it depends on the composition of the PME working group. It can depend on meetings that are potentially happening. And I would say that a lot of the times these conversations and these efforts are fragmented and they're diffuse. They might happen at a UAPS meeting. There's one conversation. There's this UAPS FP SRHR panel in which you're talking about family planning, data and measurement. We have ICFP, great conversations spread across a very large conference. We have a once every 4 years IUSSP meeting, and we have a meeting in the US, the Population Association of America, where great conversations happen. But how do we do better than that? How do we create a little bit more of an organized process? How do we identify those most critical measurement challenges and accelerate the solutions? I think that's the challenge ahead of us. Like, we've made the progress that I discussed. This is the progress that I think we need to tackle now. Next slide, please. So the Performance Monitoring and Evidence Working Group is talking a lot about how to accelerate this process, how to continue forward with a new measurement agenda that I would say builds upon what we've done and improves upon our measurement. And we're hearing, contraceptive prevalence isn't necessarily the focus of all of our community. We know donors are looking at other possible measures. We know that the gender community is looking at empowerment, agency, autonomy, how those relate to gender equality, and how family planning plays a role in that. There have been great conversations this year on maternal health and ending preventable maternal and infant mortality. And then we get questions about, well, how does one measure family planning's contribution to that? Is it just through universal access? Is that ultimately our best measure of our contribution to ending preventable maternal mortality? Can we provide aligned measures on postpartum and post-abortion family planning? I will tell you that there are definitional issues. If you ask one person, what is postpartum family planning? You ask another person. In fact, you guys can go ahead and play this game. If you put in your chat, what do you think postpartum family planning is? How would we measure progress towards that? I suspect we would get a number of different answers in the chat. And we know donors are focusing on fertility intentions. And there was a good recent post by Ann Stars from Bill and Melinda Gates Foundation on fertility intentions or intention to use family planning in particular, not just fertility intentions, but intention of family plan and use family planning recently posted and in LinkedIn and in other sources that I encourage people to read. Next slide, please. So I wanted to introduce you all to an idea that we FP 2030, the Momentum Knowledge Accelerator Project and Gates Institute have begun discussing and have begun organizing. And that is the idea of a more focused family planning measurement summit in 2024 and a series. And I call the series, I suspect these will take the form of small group work on identified measurement challenges. So what we want to do is expand engagement in measurement advancement. We want to bring together various stakeholders in the family planning measurement community to identify what those challenges are, which ones of them are near-term wins, and where we could see change, where also there are medium and long-term investments needed. And so what we hope to do with this is to foster and incubate small working group discussions with a clear path towards actionable recommendations, continuing work and analysis, indicator improvement, survey question additions, model adjustments as well. And I know some of you are already participating in some small working groups that have been incubated out of previous PME working group and other partner conversations like this. So this is our hope for the year ahead. I want to introduce that idea here and say that there is a landscaping analysis planned for the next several months in which we'll be asking the family planning community, measurement community in particular, about data and measurement challenges towards this goal of a summit and series starting in spring of 2024. I think with that, I am coming to the end. Thanks. I went a little longer than I'd hoped, but I hope I have provided you with some provocative questions, and I haven't been monitoring the chat, so I'm gonna go in there. And I don't see that the webinar chat necessarily is active, so if it wasn't, I apologize. But please do post any Q&A at this point. And I believe Connie has mentioned that you can raise your hand, I believe, if you would like to ask a question as well.
Thank you so much, Jesse. I know we have a lot of people. Thanks for the brilliant presentation. I think people have questions, and also I know some people want to use the chat. So please, if you can enable the chat, and also for those who want to make contributions or questions or comments, please, if you can just signify by raising up your hand, then Emily will enable you to speak.
Thanks, Akani. So I do see a question in the chat about the question says, can you clarify how you decide on which countries for which to report data? Do they have to have made a commitment or just to be eligible to make one? So any country is eligible to make a commitment. And therein lies a little bit of the problem of, if any country can make a commitment, should we be doing a family planning data or measurement report for the entire world? So we didn't have a good, we didn't feel like we could do that. We had the resources to do it, and that it would be useful for the community. So we chose, and we had to make a choice to report on all low and low middle income countries as a starting point, regardless of whether they had made a commitment. So not all low and low middle income countries have made a commitment. Approximately 40, I don't have the exact number at hand today, but approximately 40 countries have made a commitment. And we report on those commitment making countries as well as all other low and low middle income countries. But if countries outside of that group of 82 have made a commitment, then we also will add them to the family planning measurement report. And that's where I brought up Namibia, an upper middle income country, as an example. They made a commitment. We now have a country data sheet and all of the indicators with caveat that not all indicators are available in all countries, and so we do our best with the data available. And so now Namibia is included in this year's measurement report, and so that's the starting point. I hope that's clear.
There's a question about your view on traditional methods in African countries.
Yeah,
Do you
thank
think
you.
this is increasing? Yeah, okay.
Thank you for the question. So do we see increases in use of traditional methods in African countries? We've actually looked at trends in traditional method use, and shame my colleague, Farid is not online at the moment. She's attending another meeting. We have not actually seen increases in traditional methods. If you look over a 2-decade period, and even the 2012 to 2020 period, in general, we see a decline in traditional method use in all countries. There are still some countries where traditional method use is prevalent, quite common. And in some countries outside of Africa, it's actually higher percentage. But that is at an aggregate. So that's looking across the entire country. We do know that there are, if you look at traditional method use, disaggregate that, and you bring up highly educated or high, you could look at high or higher income quintiles as well. We do tend to see pockets of traditional method use in highly educated and higher income populations. I can't say that has increased over time, but it does remain important, an important dynamic to look at. I think many of you will know that is common in Ghana and has been for a long time, but it is striking in other countries as well. We did some analysis on this in a previous measurement report. I believe it was the 2021 measurement report. In fact, we looked at traditional method use in different populations. So encourage you to look at that. And thank you, Yassine, for starting to post some of those links. I see that maybe the chat wasn't open earlier, but I do appreciate that. I do see a Q&A. I'm going to turn to the Q&A pod. And I see a lot of questions there. I'm going to try to move through those pretty quickly. I think I answered the question on eligibility and which countries report data on from Anne. Thank you, Anne, for that question. I see a question on the AY SRHR indicators and how those were decided upon. A great question. We worked with this is, I'm trying to remember the years. I believe in around 2017, WHO and FP 2020 and a project based at the Carolina Population Center, Full Access, Full Choice, brought together a group of, I would say about 100 people working on adolescent and youth sexual and reproductive health programs, talked about measurement challenges and measurement gaps. And through that process, one produced a commentary on the gaps in AY SRHR data that is available on our website, and then talked about what could we report on that would fill in some of those gaps. And so the selection of indicators that was chosen was really based on current availability. It is not a perfect set or a complete set, but it was based on what could we start to do to improve upon the available data. Many of you know that for the SDGs, the adolescent birth rate is one of the SDGs. It was one of the MDGs as well, but it doesn't really give you insights into adolescents and youth and their behaviors and their needs and their life events. It is only an outcome, and so it doesn't tell you what you should be focusing on, and that was something we wanted to overcome. Still needs more work, and I would say this is an area where we constantly get asked questions about what more we could do.
There's one hands up. I think that's Sam Seller. Sam, sorry, if Sam can just, okay, Sam, please.
Okay, I think I'm unmuted now. Hi, Jason. It's good to see you again. I'm wondering how you're thinking about indicators, or if you're thinking at all about indicators related to laws and policies around enabling family planning access. I know that traditionally the focus of FP 2020 and now FP 2030 has been on quantitative indicators to really understand family planning uptake and access, but the policy environment impacts so much those indicators. Are you thinking about trying to quantify or qualify that in any way across time? Over.
Thanks, Sam. A great question. In fact, since the beginning of FP 2020, we have thought about how could we provide additional data on the enabling environment for family planning, including the policy environment, accountability environment. For a long time, USAID funded the Family Planning Effort Index, which was a policy-based survey done with key informants in countries. That work was actually transitioned to something called the National Composite Index on Family Planning, or NCIFP. It has been done periodically by Avenir Health. I believe we have 3 iterations of the NCIFP. It is done in a similar way to the FPE, in which it assesses policies, accountability. And when I say accountability, we're talking about, are there mechanisms for reporting coercion and rights violations? These type of accountability systems, and restrictive policies or enabling policies. That work has continued, but it has fully been dependent on the resources and investments from the Bill and Melinda Gates Foundation to the Track 20 project. So in terms of our critical dependencies, I will say that the Track 20 project remains a critical partner to us, and we've been watching closely changes within the foundation and the family planning data team, and we are aware that a lot of these things are dependent on those partners. Now, I said I wanted to bring greater availability, or we want to bring greater availability to the resources available. This is one where I think we need to bring greater light to that great work by Avenir Health and the Track 20 project, and make, I guess, we call it signposting, so that you know where to find that, Sam, and hope that that's helpful. Thanks. And thanks, Emily. I see you're online. I didn't know you were here. So if I'm incorrectly characterizing anything, I
think Jacob has a question. I don't know if Jacob, please, if you can mute yourself and speak, it'd be good to hear your voice. I think that's a question from Jacob. I'm trying to look for it.
Let's see, Jacob has been added to the screen. So Jacob, if you want to, you can unmute. There you go.
No, thank you. The question has been answered by Emily. So I was thinking that you have really done a fascinating presentation and exposition on FP 2020, 2030 measurement processes, the role of the PME working group, and all the plans for the future. I think they are really very exciting. So I was thinking that, when we talk about MCPR at a country level, we all know the reporting very useful, but then at country level, we need to see what happens below, so that countries can see where progress is, where things are lacking at sub-national level. What Emily said, those have been produced, that they are being used at country level. So even those of us who are looking at national level report, we don't get to see that. Maybe, and I think maybe on the website of Track 20, those will be available. Maybe there should be a way to allow others to have access to this, or at least be publicized widely for people to see. So yeah. I think these are great resources. I think they should be more widely available. So it's not only MCPR, I can say of the same thing for other indicators as well, but I just started with MCPR. So thank you very much.
Jacob.
Yes, I think I'll stop there. Thank you.
Thank you, Jacob, and thanks for Emily for chiming in. And I think that's the exact point that we're trying to make, which is we can only put so much in the measurement report each year. It becomes very difficult to get the same depth that countries we know countries are using. And so, as Emily mentioned in the chat, countries are using that data. They're examining it. We may not put that in the measurement report. The measurement report serves as the annual, I'll say, the annual encouragement to review that data. We know it isn't sufficient, and that's why countries really do need to focus on this process.
Lastly, I think there's a question from Shola, if you want to hit that quickly. Very close. Second, the data will be made available for researchers for further research work.
So all of the data are available on the FP 2030 website, at least at the country reporting. We have Excel file, downloadable by indicator, by country, very much available for you. If you have additional data requests, please do reach out to us. Uncertainty estimates are available as well, and we encourage more data use. We are looking at, as I said, new formats and new data visualizations and availability. So we'll be working on that, but we have always produced and will continue to produce that Excel file for users. And so happy to provide that. Thanks, Akani, for, I see there are lots of great questions. I just want to say there is one question I want to say is on how do people get involved in this conversation more generally. We will be advertising more about the Family Planning Summit and continuing series. We are really trying to encourage country engagement, really more participation from the UAPS and from partners in the countries where this family planning measurement is most relevant. And so please stay tuned. We'll work with UAPS and Akani and the FP SRHR panel to promote and disseminate those opportunities, as well as through ICFP and other formats and FP 2030. So thank you for the opportunity to encourage all of you to participate. It's now our job to make that possible and make it true. Thank you.
Thanks so much, Justin. Thanks for this brilliant presentation and also for the engagement. Sincerely want to appreciate you on behalf of the Union of Africa Population Studies, and we're looking forward to, more partnership with the FP 2030 at the organizational level. Thanks so much. Again, to thank all our participants for your time and for the contribution to this. I saw that Stacy is here. Stacy gave the lecture last month. Stacy, thanks so much. And the next lecture will be given, just block the date, the last Wednesday of every month. We want to have just 1 hour of engagement. So for next month, will be given by one of our colleagues with UNFPA, Dr. Chilanga Asmani. I also saw that it's around. Dr. Chilanga, we greet you. So we greet everybody, and again, looking forward to this very interesting conversation on another topic next month. So thanks so much, everybody. We appreciate it. Thanks, and bye-bye.
Thank you.
Thanks so much, Justin. That's good. Yeah, so we make it available on our website, the lecture. We PDF it and we make it available. Thanks so much.
Yeah, thank you. Take care.
Thanks.